Michaela.
Yeah.
Hey, how are you doing today?
Good. How are you?
I'm good. My name's Chelsea, and I'm going to be taking your x-rays today.
Okay.
So it looks like we're going to be doing pictures of your ribs. Can you tell me what brings you in today?
Yeah, I just have this really sharp pain, in my rib area that's been bothering me for a couple of weeks now.
Okay, do you know what may have started it or what caused it?
I was putting away some boxes and I heard a pop, so I think that might have been what caused it, so it's been hurting ever since.
Okay, does anything make it better or worse?
Ibuprofen every once in a while makes it feel better, but
Okay.
that's about it.
On a scale of 1 to 10, what would you rate your pain?
Right now it's probably a 5.
Okay, alright, and can you just verify your name and date of birth for me?
It's Michaela Clevenger, 9/10/94.
Perfect. And is there any chance you could be pregnant?
No, ma'am.
Okay, when was your last menstrual cycle?
Last week.
Okay, alright, so what I'm going to have you do is put a gown on. If you'll remove your shirt, your bra, any jewelry you may have from your neck up, even a belly button piercing if you have that, and just make sure the gown ties in the back, okay?
Alright,
I'll see you back in a minute. Okay, Michaela?
Yeah.
Alright, I'm going to have you come over here and face the board for me. If you'll just step all the way against the board, there you go. And what I'm first going to have her do is I'm going to make sure she's in the center, so mid-sagittal plane in the center. If you'll roll your shoulders forward for me, and then place your hands on your hips. What we're going to use is a 14 by 17 inch cassette. We're going to use a 72 inch SID, as you can see. The technique that is used for this is 120 at 2.8 mass is the technique that's going to be used for this. The CR, which is your central ray, is going to be perpendicular to the center of the IR, and will also enter at the level of T7, which is otherwise the inferior angle of the scapula. And when positioning for these, you can feel the inferior angle, and that's where you place your central ray. So what I'm going to do is put a marker on here. Just make sure your marker makes it into the light field, and you want to be about 1.5 inches above the shoulders. The top of the IR or cassette, you want 1.5 inches above the shoulders. Breathing instructions, I'm going to have her take a deep breath in, blow it out, another deep breath in, and hold it. And that's practicing with the patient, just to see where their shoulders are going to be. Because some people, when they take a deep breath in, they'll move their shoulders way up. So also just don't forget to place a shield on the patient. And again, take a deep breath in, blow it out, take another deep breath in, hold it, take the exposure, and you can breathe. The anatomy that's shown on this is the entire lung field from the apices to the costophrenic angles. No rotation should be on the image. The scapula should be outside of the lung fields, and that's by rolling the shoulders forward is how you move the scapula out of the lung field. You should see 10 posterior ribs, and that's from the deep inspiration and holding. A sharp outline of the heart and diaphragm, and lung markings are visible from the hilum to the periphery of the lungs. Next, we are going to do a PA of the ribs, and then we'll do an oblique and a spot. Okay, Michaela, so I'm going to have you show me where you're hurting, where your rib pain is. Okay, so this is on the left side. It's in the upper rib portion. So what I'm going to do is I'm going to do her image PA, and I'm going to do a unilateral. You can do it bilateral, but we're going to do it unilateral for this. Still a 14 by 17 cassette, 72 inch SID still. And what we're going to do is have her take a step to the right. And then, let's see, you can make sure you have light right here by having her pull her arm out, which I do. I don't know if you can see that, but we do. And what you want to make sure is that you have, you just want to make sure you have enough light to go to the center of the spine. You want to make sure you include the spine over. Again, putting a marker on it. That's her left side. That looks pretty good. We've got her shield on. Technique is 81 kVp at 20 mass. I'm going to have her take a deep breath in, blow it out, deep breath in, hold it, take the exposure, you can breathe. So that's our PA ribs. The anatomy shown on this is the posterior ribs. The anterior ribs are shown with greater detail because they're closer to the IR. The 1st through 9th ribs in their entirety with posterior portions lying above the diaphragm. For a unilateral examination, which is what we just did, the ribs from the opposite side possibly are seen but not included in the entirety. And the ribs are visible as well through the lungs with sufficient contrast. So now what we're going to do is go on to a PA oblique of the ribs, and we are going to do this in an RAO position because PA, you're looking at the part away. Okay, so now moving on to the PA oblique. I've got her in the RAO position. You just want to rotate her out about 45 degrees. Again, we're looking at the left side. So that is the part away from the board. And you just want to make sure again that you've got enough light on both sides, center in the center to make sure you've got the spine included. Make sure you mark it. We've still got a 14 by 17 inch cassette. Just always make sure your tube and your bucky are lined up. 72 inch SID. You could collimate down a little. We are already collimated a little from the previous, so we'll just leave it there. Maybe even open just a smidge. So for this, it's 81 kVp at 36 mass. I'm going to have her take a deep breath in, blow it out, another deep breath in, hold it, take the exposure, you can breathe. And the anatomy shown on this is about twice as much. There's about twice as much distance between the vertebral column and the lateral border of the ribs on the affected side. The axillary portion of the ribs are free from superimposition within the T-spine, thoracic spine. The 1st through the 10th ribs are visible above the diaphragm for the upper ribs, which is what we did. 8th through 12th ribs are visible below the diaphragm for the lower ribs. For this, you wouldn't see that because we focused on the upper. And the ribs are visible through the lungs or the abdomen, according to if you do upper or lower. Okay, next we're going to move on to a spot film. This is just to focus on the area of interest where she's hurting. So I'm going to switch from a 14 by 17 to a 10 by 12. So I've got a 10 by 12 in there. And I'm going to have her scoot over to the right. And see, my central ray is entering about here. Will you point to where you're hurting for me? So I'm going to turn her out just so I can see. Okay, so I need to move down following her finger. I need to move this down a little. So that is perfect. Bring this out and make sure that I'm aligned. And for this, since we are still focusing on the upper ribs, take a deep breath in, blow it out, another deep breath in, hold it, take the exposure, you can breathe, and notice I move my marker down to make sure that it is still in the light field. It is still the left side that we're concentrating on. You keep the same 72 inch SID and same technique. The anatomy shown is just the ribs surrounding the area of interest where she's hurting. And that is all for our rib series today. Thank you guys.